In this session, we'll discuss AIDS, acquired immunodeficiency syndrome. The first reported AIDS was in 1981. What is the meaning of AIDS? This is acquired because it is acquired during the lifetime. Means this is not present since birth. Immunodeficiency. When this infection takes place, the immune system of a person is weakened severely. Okay, and syndrome means a group of symptoms. Okay, what are the causative organism? The causative organism, all of you know, it is HIV, human immunodeficiency virus. Okay, it belongs to a group called retrovirus. Very, very important. Now come to the structure. The structure, its structure consists of a protein coat, okay, and which is surrounded by a lipid layer. Okay, this is the lipid layer. This is the protein coat. Now from the protein coat, some spikes are arised which are glycoprotein. So these are the glycoprotein spikes. Okay, these are glycoprotein spikes. And besides this, they have a genetic material, that is RNA. Now, what is the role of this spike? The spike helps in attaching to the host cell. Okay. Now, come to the mode of transmission. So, what are the mode of transmission? You all of you know this, but still, since it is in your textbook, so I am giving you the details. By sexual transmission, okay, by blood transfusion, sharing contaminated needles, mothers to child. This one you have to remember. Mothers to child during pregnancy through placenta. The next, during childbirth and through breastfeeding. These three are very important. Now, high risk group. किनको ज़्यादा इन्फेक्शन होने का चांस है? The first one is having multiple sexual partner. Second is intravenous drug abuser. Patients requiring repeated blood transfusion, like in case of thalassemia, sickle cell anemia, hemophilia, ये सब disease में frequent transfusion is required. Okay. Now, what is the myth about HIV? There is a myth that it is transmitted through handshake, hugging, touching, sharing food or utensils, sharing toilets, bite of mosquito or any other insect, sneezing, living together. These are all myths. By this method, the HIV cannot be transmitted. Okay. Now, its incubation period. What is its incubation period? What is incubation period? It is otherwise known as latency period. Okay. So, what is this latency period? There is a long time gap between HIV infection and the appearance of AIDS symptoms. So this time period is called latency period or incubation period. ठीक है? Very important. What is latency period? Now, and it is generally, the latency period is generally 5 to 10 years. It is about 5 to 10 years. Okay. So, but it varies from a few months to several years. Generally, but it depends on the immune system of the person who is infected. Okay. Here what happens during this period, the infected person may appear healthy but can transmit the virus to others. Okay. So before any blood transfusion, the blood of the donor must be investigated or tested for the presence of HIV virus. Okay, now come to the life cycle, which is the most common question in your exam. Okay, now life cycle of HIV. So now this HIV, when it infects, first it enters into the entry into the blood. Okay, then through the blood it first infects. I'm first giving you flow chart. Okay, it infects, first it infects the macrophages. Okay, and these macrophages are important immune cells which act as the factory for HIV production. So once this cell gets infected, let me make it in a box so that you will not get confused. So once the macrophage gets infected, the multiplication of the virus takes place in the macrophage. As a result, huge number of HIV viruses are produced. That's why it is known as factory of HIV virus. Okay, now next third step is, after infecting it, inside the the macrophage, the viral RNA is converted into DNA by reverse transcriptase enzyme. Very, very important. What is this enzyme? Reverse transcriptase. Okay. Now, this DNA, the DNA, now this is viral DNA. The viral DNA integrates into the host cell DNA. I'll show you the diagram, don't worry. Okay. Then next what happens? So this is the fourth step. Then in the fifth step, the infected macrophage continuously produces continuously produces the new, what happens, I don't know, continuously produces new HIV particles. Why I'm writing particles? Because once they are released, they are become non-living chemical inert particles. That's why the macrophages are known as HIV factory. This is known as HIV factory. Clear? Now, next what happens? After release from the macrophage, they infect the T helper cell. Okay, and it now it infects the T cell, and in the T cell replicates inside the T cell, T helper cell, T helper cell, and then what happens? The T helper cell is destroyed. Okay, as a result, what happens? Decline in immunity due to what? Progressive decrease in T helper cell. Okay, and the immune system becomes weak. Then now the person is now HIV positive. Now the body becomes, next step, the body becomes unable to fight other infections, and what happens? The opportunistic, I have told you, like tuberculosis, cough, cold, ये सब है opportunistic infections. Opportunistic infections develop. So this is the complete life cycle of HIV. Now I will show you with the help of diagram. Okay. Okay, before that, let me tell you why T lymphocyte, if the helper, because other B cells are there, other T cells are there, then why, when the helper T cells are destroyed, why our immune system is affected or weakened severely? So let us see what is the role of T helper cell. So it coordinates the immune response. It activates, very very important children, B cell to produce antibodies. So when your T helper cell is destroyed, now B cell is of no use. Okay. Now it also, that is, it activates cytotoxic T cell. Means there is a kind of T cell which produces the toxic substances which kills the pathogen. So now these cells are also activated by the T cells. So when the T cells are destroyed, so definitely the cytotoxic T cells are also destroyed. Then it stimulates the macrophage. So macrophage are the phagocytic cells, but they get stimulated by the T helper cell. Unless and until the T helper cell asks them to kill the pathogen, they will not kill the pathogen. So when the number of T cell reduces, then the macrophage becomes non-functional. They may be present in huge number, but they are non-functional, and as a result it leads to severe immune deficiency. Okay, now come to the symptoms of okay, I will give you the life cycle diagrammatically. So first it infects the macrophage. So this is macrophage, which act as the factory for the HIV factory. So this is the virus having RNA. So when it infects the host cell, it injects only its RNA. This RNA is viral RNA. Now this viral RNA is converted into viral DNA by reverse transcriptase enzyme. Okay. Now this viral, so the host cell is eukaryotic, and because in case of HIV it infects the human body. So here its own DNA is there. Okay, this is the human DNA. Now this DNA is incorporated in the host DNA. So this is the viral DNA. Now inside it replicates along with the, by using the machinery of the host DNA, it replicates and it produces a number of RNA particles. The RNA produces the DNA produces the RNA, so it forms RNA. Then RNA molecules are enclosed by the protein coats and the lipid layers, and it forms the new viral particles. Now these new viral particles are released, and now they infect the T helper cell. ओके, बट इफ द लाइफ साइकिल, ओनली लाइफ साइकिल एक्सप्लेन करने के लिए आपको पूछा जाता है तो मैंने जो स्कीमेटिक दिया है आप उसको दो. अगर आपको डायग्रामेटिकली पूछा गया देन यू गिव द डायग्राम. ओके, डायग्राम में थोड़ा मैं, दिस इज होस्ट डीएनए. सो दिस डीएनए इज इनकॉर्पोरेटेड into host DNA, then multiplies. These are RNA, viral RNA, then these are the HIV viruses. Okay, so these are all levelings. ठीक है, अगर आपको डायग्राम पूछा जाए तब भी आप देना, अदरवाइज आप डायग्राम मत देना, जो स्कीमेटिक मैंने दिया है आप उसी को दे देना. Okay, now come to the symptoms. The early symptoms. The early symptoms includes mild fever, then fatigue, then swollen lymph node, so these are the early symptoms. Now come to the intermediate symptoms. The intermediate symptom includes persistent fever. फीवर होगा, फीवर कम ही नहीं होगा. So persistent fever, then chronic diarrhea, weight loss. Okay, so these are the, and besides that धीरे धीरे loss of appetite भी होगा, and night sweats. So these are the intermediate symptoms. Now come to the advanced symptoms. आज पता नहीं क्या प्रॉब्लम हो रहा है इसको. एडवांस सिम्टम्स. एडवांस सिम्टम्स क्या क्या, देखो ये कैटेगोरिकली मैं आपको बता रही हूँ डिफरेंट सिम्टम्स. सो ड्यू टू सीवियर लॉस ऑफ इम्यूनिटी, ड्यू टू सीवियर लॉस ऑफ immunity, patient develops opportunistic infections. तो क्या क्या है आपका अपॉर्चुनिस्टिक इन्फेक्शन? जैसे आपका बैक्टीरियल में होगा आपका ट्यूबरकुलोसिस. ये किससे होता है? बैक्टीरिया से. ओके. देन वायरल इन्फेक्शन भी होगा आपका, हेरपेस. देन साइटोमेगालोवायरस. फंगल इन्फेक्शन में होता है आपका कैंडिडाइसिस, ध्यान रखो, कैंडिडिडायासिस. ओके. देन पैरासाइटिक, अदर पैरासाइटिक में टॉक्सोप्लाज्मोसिस. ठीक है. इतना आपका जनरली इन्फेक्शन होता है. एंड eventually the patient becomes immunodeficient, and then even a minor infection becomes life threatening and it leads to death. Okay. Now how to diagnosis of एड्स को कैसे डायग्नोसिस किया जाता है? देयर इज ए टेस्ट नोन एज ELISA. The full form is enzyme linked immunosorbent assay. ऐसे का स्पेलिंग देखो. It is the full form of ELISA. Okay. And it is most commonly used in detection of antibodies against HIV. तो ये क्या करता है? डिटेक्ट एंटीबॉडीज अगेंस्ट HIV. देखो, आपके बॉडी में जब कोई इन्फेक्शन होता है तो आपका बॉडी एंटीबॉडी प्रोड्यूस करेगा इनिशियली. तो अगर एंटीबॉडी प्रोड्यूस हो रहा है HIV के अगेंस्ट में, तो आपको इस टेस्ट से पता चल जाएगा एंटीबॉडी प्रेजेंट है, मतलब इन्फेक्शन है. इसके अलावा और क्या क्या टेस्ट है? वेस्टर्न ब्लड टेस्ट. एक मिनट. वेस्टर्न ब्लड टेस्ट, याद रखो ये सारे टेस्ट. देन PCR एंड रैपिड HIV antibody test. Okay, so these are the tests. Now come to the treatment. There is no complete cure. No complete cure, but antiretroviral therapy can control this. Antiretroviral therapy can control it. Okay, very very important. Antiretroviral थेरापी. तो हाउ दीज ड्रग्स वर्क, ये कैसे काम करता है? स्लोज डाउन, मल्टीप्लिकेशन को रोक नहीं सकता, बट स्लो डाउन द HIV मल्टीप्लिकेशन. मल्टीप्लिकेशन को स्लो कर देगा. ठीक है. तो जिसके वजह से क्या होगा? रेड्यूसेस वायरल लोड, वायरस का नंबर कम कर देगा. एंड जो डिजीज बहुत रैपिडली हो रहा था, अभी ये क्या करेगा? इट डिलेज प्रोग्रेशन ऑफ डिजीज. ओके. एज ए रिजल्ट द क्वालिटी ऑफ लाइफ इज improved. Improves quality of life. and life expectancy is increased. But याद रखो, जो असिस्टेड रिप्रोडक्टिव टेक्नोलॉजी हम एडप्ट करते हैं for infertility, this cannot completely eliminate HIV, please note down, and it only prolongs life and reduces complications. Now, how to prevent this? Prevention, all of you know this, so still I am writing prevention. The prevention includes safe blood transfusion. My God. Safe blood transfusion. Then disposable needle must be used, and then safe sexual practices. Then avoid sharing needles. Then HIV screening जरूरी है फॉर दोज हु आर एट हाई रिस्क. कौन हाई रिस्क में है ऑलरेडी मैं बता चुकी हूँ. देन मदर टू चाइल्ड प्रिवेंशन. सो ये कैसे प्रिवेंशन हो सकता है? ड्यूरिंग प्रेगनेंसी. प्रेगनेंसी के टाइम अर्ली डायग्नोसिस करके अप्रोप्रिएट ट्रीटमेंट अगर करेंगे तो चाइल्ड विल नॉट बी इन्फेक्टेड. And then most important is public awareness. Okay, now role of there some organizations are working for this. Role of organizations. So what is the role? They conduct awareness program, promote फ्री ऑफ कॉस्ट. ये क्या करते हैं? HIV टेस्टिंग कराते हैं. promotes HIV testing, provide फ्री आर्ट मेडिसिन. जो आर्ट से जो कंसीव करते हैं ना उनको मेडिसिन प्रोवाइड करते हैं. एंड एंश्योर सेफ ब्लड सप्लाई. जैसे ब्लड डोनेशन कैंप करते हैं वहीं पे ब्लड का स्क्रीनिंग करके ब्लड फिर कलेक्ट करके ब्लड बैंक को देते हैं, सो दैट द रिस्क ऑफ गेटिंग HIV इन्फेक्शन बाय recipient will be prevented. Okay, they also prevent the mother to child transmission. Now WHO has WHO को क्या करना है कि उसका एम एंड ऑब्जेक्टिव्स क्या है? WHO का WHO यू नो द फुल फॉर्म इज वर्ल्ड हेल्थ ऑर्गेनाइजेशन. तो प्रिवेंट्स HIV. ये क्या क्या कर रहा है? वर्ल्ड एड्स डे इज देयर ऑन 1st December एवरी ईयर. सो प्रिवेंट HIV spread globally. Promote safe healthcare practices. Then improve HIV diagnosis and treatment. Then support awareness program. ठीक है, इतना ये को WHO को करना है. और इसमें थोड़ा सा मैं बोल देती हूँ आपको, इफ पॉसिबल यू जस्ट राइट डाउन. सोशल अवेयरनेस इज वेरी इम्पॉर्टेंट. क्योंकि HIV पॉजिटिव इंडिविजुअल से ही इन्फेक्शन होता है। तो क्या अवेयरनेस रहेगा? जस्ट राइट डाउन, HIV पॉजिटिव इंडिविजुअल्स शुड नॉट बी आइसोलेटेड, not face discrimination, receive sympathy, care and emotional support, and receive proper medical treatment. इतना चीज़ हमारे HIV पॉजिटिव इंडिविजुअल के साथ क्या क्या होना चाहिए, क्या क्या नहीं होना चाहिए, उसको अलग से नहीं रखना चाहिए, ताकि उसका वो डीमोरलाइज हो जाएगा और जल्दी जल्दी उसका लाइफ एक्सपेक्टेंसी जो है वो डिक्रीज हो जाएगा। कोई डिस्क्रिमिनेशन नहीं करना है, ही शुड लीड ए वेरी नॉर्मल लाइफ, लेकिन हमको केयरफुल रहना पड़ेगा, उसको सिंपैथी दिखाना है, केयर लेना है, इमोशनल सपोर्ट देना है, ठीक है, और उसको प्रॉपर मेडिकल ट्रीटमेंट भी देना है। और सोसाइटी को ये समझना चाहिए कि HIV पेशेंट डिजर्व्स डिग्निटी एंड रेस्पेक्ट, उसको भी रेस्पेक्ट चाहिए। एंड दिस स्टिग्मा इंक्रीज द स्प्रेड ऑफ डिजीज बाय डिस्करेजिंग टेस्टिंग एंड ट्रीटमेंट। अगर कोई स्टिग्मा अराइजेस देन दैट इंक्रीजेस स्प्रेड। कैसे? आप उसको टेस्ट कराने नहीं ले जाओगे, टेस्ट करने के लिए नहीं दोगे, तो धीरे धीरे वो स्प्रेड होता जाएगा, ठीक है। सो दैट्स ऑल फॉर अबाउट एड्स. So here I stop my discussion. Next topic will be cancer and drugs abuse. So that I will be discussing in my next session.